Hi, I'm Dr. Deepti Jain, and I'm a spine surgeon. I treat thousands of patients every single month with both back pain and with what we colloquially call sciatica. So in this video, I'm going to talk to you about back pain versus sciatica and what that means. So back pain references pain in the low back, very typically. Sciatica is a colloquial word, and what that typically references is pain that radiates from the back that goes down the buttock and down the leg. The medical terminology for this word is radiculopathy. Now that's a big word, but what that means typically is that there's a nerve root that is irritated, that is causing that kind of pain. So there are lots of different spine conditions that can cause sciatica, but in short, the issue is that the nerve root is irritated. So some of these different things that can cause that nerve root irritation is a disc herniation. So if there's a disc herniation, that's when there is pressure on the nerve root from the jelly-like substance that is within the disc, and it pushes on that nerve. And that nerve gets very irritated. One, from the direct mechanical compression, but two, because there's this inflammatory milieu around a disc herniation that just really irritates the nerve. Another thing that can cause sciatica is if there is instability or abnormal motion in the spine. So a very common condition is called degenerative spondylolisthesis. Some people will reference this as a slipped disc. Again, that is a colloquial word, not a medical term. But degenerative spondylolisthesis, that is when one vertebra moves forward on the other vertebra. And when that happens, that abnormal motion really irritates nerves. It puts pressure on the nerves and it makes them very unhappy. That can cause symptoms of sciatica. Another common condition that we see is when the nerve channels, as the nerves exit the spine, become pinched. And that can also cause sciatica. So for example, if someone has disc degeneration, as the discs degenerate, the spine collapses and the vertebra and the space in between the vertebra collapse. And so there are nerve channels here, and that nerve channel becomes smaller as the disc collapses. And that can physically put pressure on the nerve and really irritate the nerve and cause sciatica. So how do we treat sciatica? Well, there are lots of different options. There's the non-operative care bucket and there's the operative care bucket. So in the non-operative care bucket, the non-operative care bucket is large. It can include things like physical therapy. Is physical therapy ever going to unpinch the nerve? No, definitely not. But that's not what's relevant. What's relevant is that the pain gets better, and physical therapy can help the pain get better. Next, various different kinds of medications. That can also help with the pain. These can include things like anti-inflammatories, like steroids, like nerve pain medications or muscle relaxers, or a combination of them. We can also try different kinds of injections. So if someone has sciatica, someone can get what's called an epidural steroid injection. That is an injection where the steroids are targeted and bathe the nerve root in steroid to reduce the inflammation. Finally, there's operative care. Operative care is also its own big bucket, and the specific type of operation is going to be very specific and tailored to the exact anatomy that is on the MRI. We have to be able to see the nerve pinching, see the instability in order to actually do something about it during surgery. We can often see whether or not a patient has any nerve pinching or nerve pressure. Those are things that we can address during surgery, and that's something that we identify on the X-ray and the MRI. So on the X-ray, we can see if there's abnormal motion in the spine that's contributing to nerve root irritation. And on the MRI, we can actually visualize the nerve roots. We can actually draw them out and see if there's pressure on that. As surgeons, we can only address things that we can see with our eyeballs. So that's really, really critical, is we have to be able to identify the anatomic finding on the imaging so that we can address it during surgery. So I'm Dr. Deepti Jain. If you like what you're hearing, hit the like button and also subscribe. And we deliver new information about neck and back pain every day.